At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live.
Hey, all right. Hello and welcome. I'm Jeff McIntyre with the Global Liver Institute. I'm the Vice President of Liver Health Programs at GLI, and I am truly excited to be here today and join you all and host this episode of GLI Live the day before Global Fatty Liver Day. We're putting the global into Global Fatty Liver today with today's special episode. Now, GLI convenes Global Fatty Liver Day, which used to be known as International NASH Day, each year on the second Thursday in June. Now, to recognize Global Fatty Liver Day tomorrow, GLI is releasing educational resources and leading partners around the world who will host grassroots events to combat fatty liver disease, tailored to the needs and resources of each community and each nation. Now, this year we have over 220 partners and 30 medical society endorsements from dozens of countries around the world. So in this episode of GLI Live, I'd like to welcome leaders from around the world to share their work and their plans for this year's Global Fatty Liver Day. Dr. Ladrón de Guevara, Teresa Davidson, Michael Ochieng Nyawino, and Dr. Carmen Ester, Halal Duda, and we may be joined by one other to come in here as well. We'll announce her if she's able to make the connection. Always a trick with doing these global things. So thank you everyone for joining us. It's a pleasure to see you and to see your faces. I love the technology that allows us to collect globally for this. I want to start. Carmen, let's start with you. Tell us who you are. Talk about your relationship with liver health, kind of where you are in the world and what you serve, and a little bit about the work you do.
Thank you very much for the invitation. I'm a medical doctor practicing gastroenterology and hepatology in Romania, in Europe, Central Eastern Europe, let's put it like this. And I'm also a part of the liver transplantation program in Romania. Today I'm speaking to you as a representative of the Romanian Association for Liver Diseases, which is a non-profit medical association that was founded 6 years ago. And we are having many events related to hepatology, but especially a major educational event, the annual update hepatology course, which is also endorsed by many societies in Europe. And we focus on bringing resources, raising awareness for liver diseases, and also involving specialties, many other specialties other than gastroenterology, and also patients in understanding and treating liver diseases.
Excellent. Halal, why don't you tell us a little bit about yourself and about where you are and what sort of community you serve in your relationship to liver health? Yes, Halal, are you with us? I think maybe we can hear you. Can you hear us? Hello, we can hear you. If you will, where are you at?
Me?
Yes. See.
Yes. Hello. Okay.
Hello.
Me?
Yes. Yes.
Hello. My name is Hilalinamış Duda from Istanbul, Turkey. Continue. I started
please.
my work again.
Yes.
I started my working life as a journalist and then worked as a lecturer at the university. I am retired now. I have been on liver and hepatitis platforms for the last 15 years. Why? I founded the Hep Yaşam Association 12 years ago. I am still the president. My field of work has always health policies, public health, free treatment, access to medicine and treatment, the importance of immunization, support from NGOs. I live in Istanbul. You want my introduce like this. If you want about my association now, after.
Yes.
Which one?
Yes. Yes,
now?
please. Yes.
Okay. The name of our association is in name Hep Yaşam. Hep of the word hepatology, as you know. The meaning of Yaşam is life. Our association was founded 12 years ago by patients. Broken again? No. Doctors are still our advisors. I lost my mother 12 years, my mother 18 years ago from hepatitis and cirrhosis. Later, I became interested in these issues. I am also diabetic and currently having a fatty liver problems.
Excellent.
My countries.
Yeah.
Sorry.
Yes. Go ahead.
My country's geographic position, maybe you know, Turkey is located on the Mediterranean Sea between Asia and Europe. Our population is 85 million, more than 7 million registered or unregistered refugees recent years. Some associations dealing with the health issues of these people also work, especially regarding hepatitis and children's immunizations about liver. In Turkey, public and private health institutions operate in my country. Children's vaccinations schedule includes hepatitis A and hepatitis B vaccines. All hepatitis drugs are covered by reimbursement. There are approximately 2.5 million patients in hepatitis patients. Our doctors working in the field of liver work to treat patients with liver cysts, very common, and cancer and fatty liver. Regarding the liver transplantations, there is a worldwide center in the Malatya, the other city in my country, that performs 6 cross liver transplantation at the same time. Maybe you read from newspapers last month. I follow some information about FDO. approved drug issues from the media and ELPA. You know ELPA, maybe. I am ELPA member, European Liver Patients Association.
Mm-hmm.
Maybe you know. About drugs name, I will say, I would like to say my principle. My principle is don't speak about drugs names and companies, medicine companies names. I always generalize about hepatitis C drugs or hepatitis B drugs like this. I never say the name, the drugs of the name pharmacy companies. As far as we know, there is no drug for fatty liver disease. I don't know. But we are using some metformin. You know metformin?
Mm-hmm.
It's metformin is not drug's name. I am using also. I do not find it right of a patient association to advisement a drug to the public. It's not true for me. Okay.
Hello, let's come back to that point. I want to make sure we get around to everybody because we do have a question about that specifically in a moment.
Okay.
I
have two questions more.
I want to recognize
Mariela.
I want to recognize Mariela Fischberg, who is joining us from Argentina, and Laura Ladrón de Guevara, I believe I'm pronouncing that correctly, who's popping on the screen right now as well. Thank you for joining us. I'm going to come back to you, and let's go ahead with Michael for an introduction. Michael, I have to say, I just saw a video interview with you, and so I feel like you're an old familiar friend. Tell us a little bit about where you are and about what your relation to liver health is.
Yes, thanks, Jeff, and thanks everyone. Good evening from Kenya. I'm Michael Ochieng Nyawino, the Executive Director of Christian Community Healthcare Foundation Kenya, abbreviated as COEF Kenya. So basically, COEF Kenya, we are located in the western part of Kenya, serving 5 counties of Trans Nzoia, Bungoma, Kakamega, Busia, and Vihiga. So for us as COEF Kenya, we started relating with the GLI in the year 2021, when we started conducting community awareness program to educate the community about the need of taking care of their liver. So mostly the campaigns that we have conducted mostly touched on the symptoms, the causes, prevention, and the treatment of the liver disease. And in addition, we also took part in a research that was being conducted by GLI to collect information on liver health is public health. That was in the year 2022, where a lot of information was collected on Kenya, and we used the information that was collected now to partner with the hospitals, at the same time also help educate our community members. And as an organization, COEF Kenya operates under 5 key pillars of health: education, peace, agriculture, youth, and women empowerment. Thank you.
Excellent, excellent. Kenya is close to my heart in this. I know there's a lot of issues that we can learn from that section of the world. Teresa, an old friend of Global Liver and member of our Liver Action Network. Hello from where you are. Tell us a little bit about, for those that are listening for the first time, about where you are and about what your connection to liver health is. And we have you on mute.
There you go.
There you go.
I'm Teresa Davidson, the Executive Director for the Mid-South Liver Alliance. I am based in the Mid-South region, which includes Tennessee, Alabama, Kentucky, Mississippi, Arkansas, and Louisiana. 6 of the most unhealthiest states in our country. And I started the Mid-South Liver Alliance in March of 2021. I had worked a little bit in liver with the American Liver Foundation. Before that, I was in the renal world and had started the Tennessee Kidney Foundation here in Nashville, Tennessee. Doctors knew that I'd started it and wanted me to do something. And I said, okay, if we're going to do it, we're going to do it in the Mid-South, and we're going to work together to really get the education and awareness out there for liver disease, because there's not a lot out there. And we have a lot of rural areas. We have a lot of areas that don't have a lot of hepatologists. So it's really hard for people to find out about liver disease. And it takes a long time for them to get diagnosed sometimes. So we're really trying to build the education and awareness up about liver disease in the Mid-South area. We're committed to improving, educating, advocating, and supporting children, adults, and families affected by chronic liver disease in those Mid-South states.
Wonderful. Laura, let's go to you next. Thank you for joining us. I'm so happy we got our connection issues worked out. Our technology is an analogy for patients getting connected all over the world and working together. So tell us a little bit about yourself and about your connection to liver health to get us started here.
Thank you. Well, I'm Dr. Laura Ladrón de Guevara. I'm based in Mexico City. As you know, it's like the 6th biggest city in the world. We have 2 million people here living. So we have a lot of issues. As you know, in Mexico, we have the one big problem with obesity. We are the 2nd place in Mexico, in the world. So there is a lot of obesity problems, and pitifully, these have not been addressed in this generation. So I am graduated from the National University, where a lot of social programs are developed there. So I'm a gastroenterologist and hepatologist. I work in one of the medical centers here as a hepatologist for a liver transplantation program. The last 5 years that I worked there, I worked at that hospital 30 years. I was the chief of transplantation. So I saw a lot of problems because we couldn't transplant patients, and liver disease is the 4th cause of death in Mexico. And most of it is related to obesity. So every time that we will go to get a liver, it will be a fatty liver, so we couldn't transplant it. So I thought I should start something to improve this health problem. And I got the chance to meet Vlad Ratziu, and he told me, but what are you doing? And I told him, well, at the moment I'm doing nothing. And he said, you can do research. So I started doing research in several trials. And finally, after I left the public institution, I founded a research center where we are doing research on different medications, and also we give free diagnosis for people with transient elastography, and also we do every 3 months we do a health event for patients. So they get to know the diseases that are a problem in Mexico, like obesity, diabetes, liver disease, heart disease, and also we promote sports like running and walking. So there is a lot of work after you leave the public institution. So
It is. I feel like Mexico. Oh, there we go. I feel like Mexico is such a great example of this, of the population, as you said, it's 4th leading cause, but there's also so many great things we can learn from other countries, and Mexico comes to mind. I just read you have so many progressive policies about things like front of package labeling, for instance, that helps individuals avoid foods or dietary hazards that may put them a little more at risk. Mariela, I understand you're on public Wi-Fi. I thank you for making the effort to join us so much. I do hope we can get through both our technology and our language here with this. If you have the ability, would you like to say hello, introduce yourself, and talk a little bit about your connection to liver disease? You are muted.
Soy de Argentina, de Buenos Aires, capital federal, la ciudad autónoma de Buenos Aires. Y acá en Argentina yo trabajo en hospital público, ¿sí? Es un hospital de bajos recursos. Trabajo en internación de clínica médica hace muchísimos años, donde vemos pacientes de todo tipo de dolencias del hígado, no solamente este tipo de pacientes, sino pacientes muy avanzados con cirrosis. Y trabajo también hace muchísimos años en la parte de consultorios, donde siempre estuve en el área de cardiología. Entonces, por estar en ese área, siempre los pacientes cardiometabólicos me llegaban a mí y los pacientes de hígado graso, el mismo hepatólogo me los derivaba a mí, porque, bueno, era la persona que estaba capacitada en todo el área metabólica, digamos, el área de nutrición. Así que, bueno, siempre tuve como relación con este tipo de pacientes. Desde ANEP, que es la Sociedad Argentina de Nutrición Enteral y Parenteral, la Asociación Argentina de Nutrición Enteral y Parenteral, se formaron grupos de estudio y uno de los grupos de estudio tiene que ver con las enfermedades hepáticas, en el cual estoy siendo la coordinadora ya desde, este es el segundo año, digamos. Así que desde el grupo de enfermedades hepáticas es el tercer año consecutivo que participamos en los eventos del GLID. Bueno, antes era el NASH y ahora, bueno, cambiamos por la nomenclatura el tema del día. Pero bueno, ahora estamos participando nuevamente para el Día Mundial del Hígado Graso.
Excellent, muchas gracias. Okay, let's go around again. As we recognize Global Fatty Liver Day this year, we have just released a report on best practices in liver health globally as part of our Liver Health is Public Health campaign. I'd like each of you briefly to say one thing about where you are. This is specific to geography. One thing where you are that is a specific challenge for liver health, and how you try to engage that. You know, how does your organization try to approach that? So, Carmen, let's go back to Romania. Go back to you. Yeah. What is one challenge that you see in Romania, and how do you address that?
Probably the most important issue for public health in Romania is the metabolic liver disease. We have a lot of concomitant metabolic and alcoholic liver diseases. It's very hard to differentiate between them. It's really, we see it in clinical practice as increasing a lot, especially during and after the COVID-19 pandemic.
Excellent. Okay. Halal, let's go to you next. What is one main challenge of liver disease in Turkey, and what is something that you do to try to address that? And you are muted again. And Halal is frozen as well. So we will come back to Halal. Michael, why don't we go up next to you? Talk about is there something you would identify as one main challenge in terms of liver health in Kenya? And what is your organization? What do you do to try to address that?
Yes, once again, Jeff, thank you. Mm-hmm. Now, generally, there is a significant lack of available data on the prevalence, incidence, and mortality of liver disease in Kenya. And as such, a lot of people don't go for screening. People get sick until such a time that the disease has got to an advanced stage. That's when now they visit the hospital to a point whereby they cannot be helped. So as an organization, we are carrying out awareness campaigns so that we encourage people to go for early screening so that we could be able to prevent disease early enough.
Excellent. Teresa, let's come back to Tennessee. It's an area, you can't tell, Teresa and I have very similar accents as I was grown and raised near there. Very familiar with that. What would you narrow down to being one main issue with liver health in the American South, and how do you try to address that?
Well, I think everyone knows that diabetes and obesity in my states we're the 6 worst states for those numbers. And because of that, the NAFLD and NASH is running rampant. And we have over 9 million people that are developing or that have it. And then 30% of those will end up developing NASH. The other problem we really have 2 problems. We have that problem, but we also have the problem then that it's a lot of rural areas. There's not a lot of hepatologists. Most of the hepatologists are centered around transplant centers. We do have 11 transplant centers, but they're in one section of the state, and all these other people all across the rural areas are having trouble getting the help that they need and knowing what they have.
Understood. I'm sensing some trends here. Halal, are you with us? And if so, can you speak to one main issue in liver health and kind of what you're doing to address it? Okay, we're going to move on while we figure out the buffering issues on the back end. The production is always fun with this. Laura, in Mexico City. I was in Mexico City not too long ago. I know certainly you have the huge population there presents challenges just by itself and the demographics. Okay, is there one thing you could narrow down in Mexico or Mexico City where you feel like is the main health challenge for liver health, and what do you guys do to try to engage that?
To address that exactly. You know what happened here at that is that everybody tries to hide if there is liver disease in their family or they have liver disease, because liver disease is stigmatized as alcohol drinking problem, as people do. And now our purpose is to educate people that most of the liver disease is related to obesity and diabetes, and that
dondum ben, korktum gibi.
I mean,
Hiç kimse kımıldamıyor ve siyah oldu ekranda.
The liver disease. That is the main problem. Everybody wants to hide that they have some kind of liver disease because it is stigmatized as alcoholic liver disease. Yeah.
I'm sensing some themes. I'll come back to it of metabolic, of screening, of diabetes. I'm seeing these issues that everybody experiences is on this. Okay, we'll give it just a second for Mariela. Welcome back. And we want to talk about one thing in liver health that you find challenging in Argentina and what you do to try to address that.
En el país estamos bastante atrasados, falta muchísimo por trabajar. Nosotros desde el grupo de ANEP el año pasado lo que quisimos fue ir a las redes sociales para que se empiece a hablar y romper con el silencio, fue la idea, porque realmente faltaba muchísimo. Yo acá trabajo en el hospital y la gente la comunidad médica no hablaba del NASH, no se diagnosticaba. Me decían, yo no sé de eso, para que se den una idea. Y fue, digamos, muy bueno, muy positivo, porque a partir de ahí se empezaron a diagnosticar más pacientes, empezaron a tomar conciencia acerca de lo que no se conocía, no se hablaba. Así que fue un trabajo nuestro, pero la realidad es que falta muchísimo porque no hay un trabajo desde el Estado, que es lo que debería haber en esto que digamos, está siendo una epidemia tan grande, que no basta con que un solo grupo, digamos, esté trabajando en esto. Pero bueno, por lo menos rompimos, como se empezó a hablar del tema y se empezó a diagnosticar. Y ahora este año lo que queremos, digamos, lo que vamos a hacer es un workshop para que ya directamente vayan y hagan el screening y lleven a la práctica, digamos, lo nutricional y digamos, que puedan llevar a la práctica paso a paso lo que hay que hacer con estos pacientes, porque falta mucho por hacer realmente. Y después, bueno, el tema del diagnóstico, que los fibroscan están, por ejemplo, solo en lugares privados, no hay en los hospitales públicos. Entonces, la importancia del screening es muy importante y falta mucho trabajo en eso. Por eso vamos a hacer hincapié en este workshop para que aprendan a hacer el screening todos los profesionales de la salud.
Whoop, there we go. Okay, excellent. I'm going to try to kind of round out the conversation here with, our theme for Global Fatty Liver Day this year is Act Now, Screen Today. And organizations like all of yours that partner with Global Liver around the globe are hosting grassroots campaigns. You're doing screening events, walks, educational days. In conclusion here, I'm wondering if you can share a little bit about what the work each of you are doing in your communities this year. How are you recognizing Global Fatty Liver Day? And then what is your call to action for the country or the region that you're in? So what are you doing and what do you feel like needs to be done going forward here? Carmen, we'll start back up with you on this as well. Tell us a little bit about what you're doing for Global Fatty Liver Day and then what you feel like needs to be addressed going on.
Okay, so we are planning a series of events for this special day. We will start with educational workshop in a primary school. We have an interactive event with the children aged 9-10 to try and teach them about balanced nutrition, about the importance of exercise. And we also plan going to a public space where we'll show a green buffet with fruit, vegetables, healthy food generally. And we'll also share flyers and fridge magnets to increase awareness and have people take home the messages we want to share about liver health. And we'll also be doing an exercise event with doctors, nurses, and patients to help increase the awareness of the importance of exercise in liver health and overall well-being.
Excellent.
And actually, there are a lot of things to say about the call to action. In Romania, there are a lot of things to be done. But it's very important, first of all, to increase awareness about a healthy lifestyle, about having a balanced weight, and including exercise in every kind of profession and at any age, have them acknowledge the importance of regular exercise.
Excellent. Music to my ears. I would love to have physical activity in every profession. I think that's a wonderful goal and a great call out to have as well. Halal, we'll take another shot. Are you with us? And talk a little bit, if you can, about what you're doing for Global Fatty Liver Day and what a call to action, what you'd like to see done to help liver in Turkey.
Yes. Before question, can I say now? Our challenges in my country. Yeah, I can't speak. Yes, we have some problem, especially diabetes. Very, there are very patients in diabetes, and fatty liver and hepatitis, our problem in my country. Now, this year's slogan is Act Now and Screen Today. This is nice slogan. Our association is a classical association that provides social education, organize some campaigns, use social media, and works to raise awareness. Unfortunately, our budget is not good, not big, very limited. This year, we planned to prepare 2 videos about Liver Day. And we have got some sports organization in the hospital, in the public parks. We have got a sports manager as a volunteer working for our association. So another issue, liver-friendly nutrition. Because of our fooding are not friendly for liver in my country. We will get advice from a nutritionist about some food, how cooking like this. And we will share on the social media all of them. Also, we will preparing cartoons in Turkish, maybe in English also. Healthy liver and young. They are speak each other. Fatty liver and healthy liver. I am sorry.
All right, thank you, Hilal. We're gonna. No problem. This is the nature of doing good work: is to be patient and
Maybe
be
now.
patient with ourselves in this.
Okay.
Michael, let's pop over back to Kenya. Tell us a little bit about Global Fatty Liver Day, about what you're doing, and then what you see as kind of the big challenge there.
We will information, social media.
Yeah,
Yes,
Michael, on you.
Yes, thank you. Now, on the Global Fatty Liver Day, as an organization, we've planned to conduct community awareness campaign in partnership with a local hospital, where we'll be inviting the community to come so that they could be educated on the need of protecting their liver. And also, in addition, we'll also visit the Kenya Medical Training College in Webuye campus. That also has got students who are pursuing courses in the medical field, also to discuss with them the issue of the fatty liver disease. On the day that we'll be hosting the community in the local hospital, we'll have a nurse who will take the community throughout that session on how and why they need to take care of their liver. Also, we'll have a nutritionist who will be talking about the need to eating healthy. At the same time, we also have a gym instructor. Now, the gym instructor will be taking people through simple exercises that someone can be able to perform even in their own homes without really visiting the gym. Now, our call to action, just like or the action of visiting an hospital and do that early screening, at the same time conduct regular exercises and continue eating healthy without going for junky food. Thank you.
Excellent. Thank you, sir. Teresa, what's going on in Nashville? What are you guys doing for Global Fatty Liver Day, and kind of what would be a call to action you see for addressing?
My big call to action this whole year is to do more patient education and awareness and getting them the questions they need to ask the doctors so that they can be diagnosed quicker. So we're doing a patient educational program in Birmingham that Saturday after Global Liver Day. And we have some really great people or guest speakers that are coming in from out of town that have been involved in liver disease for a long time, as well as we have an endocrinologist, we have a hepatologist, we have a transplant doctor, all talking about liver disease and being there to answer questions for the patients that show up to the meeting. So we're really excited about it.
Excellent, excellent. Laura, in Argentina, what is, or excuse me, not in Argentina, Mexico City. Forgive me, what a grave error that is. Tell us a little bit about what's going on for Global Fatty Liver Day for you, and what you see is what would be a good call to action to engage fatty liver disease going forward. You are muted. Oh no.
Yes.
Yes.
Yeah. Well, it's good that you said about Argentina, because we are doing something similar to Mariela, that we're using the social media to get to our patients. So we are starting to do like these small animations where we have this liver cartoon that promotes liver health, and we have this other fatty liver cartoon that it shows how he gets the disease and how it progresses. Because what people do not understand here is that it's not like cirrhosis is something that happens like a miracle, I would say. It's something that it has a time to set up, and these are the times that we call fibrosis, right? So we are starting to teach them that fibrosis can be reversible, and fibrosis is a disease. So that is one of our focus on the social media like Instagram and Facebook, whatever. And the other thing that we're doing a workshop with physicians, also for patients, and we are also doing our traditional run with your pet. We have in one of the ecological areas in Mexico City, and where people are encouraged to come and participate with their pets and run about 2 or 4 kilometers. It depends on their age. But last time that we did it for obesity, like 3 months ago, about 100 people joined, and one of these persons joined like 3 or our events. So we're, and I think that all these efforts should start to improve Mexico's health, hopefully a little bit.
That's excellent. We know it's good for our health and good for your pet's health. Get them out for a walk as well. That's wonderful to hear as well. Mariela, this time in Argentina, I think I can get that right as well. Talk a little bit about what you're doing for Global Fatty Liver Day and what a call to action might be for something that you feel like needs to be done going forward. We've got you on mute. There we
Para
go.
el Día Mundial del para el Día
Sí.
Mundial del Hígado Graso estamos organizando desde la ANEP, como socios del GLI, el workshop que va a estar dirigido a todos profesionales de la salud, que va a estar conformado por un hepatólogo, una cirujana y una nutricionista que es del mismo equipo del hepatólogo y la cirujana de un hospital que hacen trasplante de hígado y que pertenece a nuestro grupo de enfermedades hepáticas de ANEP, o sea, conjunto conmigo, las 4 personas vamos a estar armando este workshop que va a estar dirigido a todos los profesionales de la salud, va a ser bien práctico, así que lo que vamos a estar haciendo va a abarcar desde el hígado graso hasta etapas más avanzadas, con el soporte nutricional incluido en las etapas avanzadas, así que va a ser bien completo. Así que para que lleven a la práctica todo y puedan, desde hacer un screen de diagnóstico hasta el soporte nutricional. Así que los esperamos. Y por el otro, bueno, sí el llamado a la acción para que diagnostiquen y se hagan los screening a todos los pacientes.
Excellent. Okay, I'm going to come back to everyone with one last thing, but first, I want to thank everybody for joining us for today's episode. We see that not only is fatty liver disease an issue around the world, but so is buffering, and these video calls can present challenges globally as well. So I really appreciate everybody's patience and diligence and willingness to show up and have this important conversation about this. I want to wish everybody the best with your upcoming events. And I really do speak for all of us at the Global Liver Institute when I say that we are humbled and frankly blessed to collaborate with each one of you. I learn so much from my international colleagues. I am forever in your debt as we try to engage and try to better support each other in engaging this progressive chronic disease. I want to encourage everyone at home to learn more about our guests and their organizations in today's show notes. Make sure to join the online conversation tomorrow using the hashtag Global Fatty Liver Day, and find us at globalfattyliver.com as well. Now, across all social media platforms, we'll be there as we collectively raise awareness about this preventable yet life-threatening disease. My final ask, and this is a little unorthodox, but my final ask, in order to take us out today, I want to go around again, since we represent so many wonderful places in the world, and have each of you, if you would say for us, if you would say for us for our theme, Act Now, Scream Today, in your native language, so we can truly get linguistic variety here. Well, actually, Laura, I'll start with you since we have 2 Spanish speakers, but 2 different dialects. We'll start with you and we'll come full circle. Laura, you're muted.
You're right. Actúa ahora y obtén tu diagnóstico gratis.
Excellent. Carmen.
Acționează acum și testează-te astăzi.
Great. Michael?
Chukua jukumu uende upimwe.
Excellent. Halal. We'll come back to halal. Okay, Teresa, take us out in English.
Act now, screen today.
Excellent. Everybody, thank you for joining us for our special Global Partners edition of GLI Live for Global Fatty Liver Day, for wherever you are in the world, in the country, in your life. Thank you so much for joining us today, and we'll look forward to seeing more about your activities tomorrow on Global Fatty Liver Day. Thank you.
Thank
Thank you very much.
Thank you.
Thank you.
Bye.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay